Stick with me through this video and I will explain how you can take back control of your body by inducing a state of calm by activating the relaxed part of your central nervous system. This video is also for people who just want to bring more calm into their life, or for people who are supporting others that are struggling with stress or panic. I'm Duncan, a GP working in the UK with an interest in truly holistic ways to reach optimum physical and mental health. It's an honour to be your guide to help you achieve the best state of health possible. Before I explain how to put your body into calm mode, I first need to explain a bit about your nervous system so you know what's happening as you flip the switch into a more relaxed state. For the purpose of this video, I will split the central nervous system into two parts to keep it simple. The sympathetic nervous system controls your alert state. It increases your heart rate and blood pressure, slows digestion, moving blood flow to your muscles, makes your senses heightened, and makes you more awake and focused, among many other things. The sympathetic nervous system activates when you're stressed and is responsible for triggering and maintaining a panic reaction. The parasympathetic nervous system controls your calm state. It's basically the exact opposite of the sympathetic nervous system. It's sometimes called the rest and digest state, as it activates after eating, so you don't move around too much in order to properly digest your food. That relaxed and tired feeling you get after a good meal is your body switching to parasympathetic control. The agitated state created by the sympathetic nervous system is turned off when the parasympathetic nervous system is activated. You will soon find out how to do this yourself with a simple exercise. The word stress is frequently used incorrectly in the modern world, often been used to describe a stressful situation or trigger. Stress is actually the protective system in your body that activates to help you get out of danger. Stress involves putting your nervous system into sympathetic control and the release of stress hormones like cortisol and adrenaline. It's only intended to be active for a short time, but the modern world seems to be set up to trigger stress all too frequently. Long-term or chronic stress has many negative consequences. It affects your cardiovascular system, putting strain on your heart and blood vessels. Chronic stress also impacts the immune system, leading to increased inflammation and a reduced ability to fight infection. This increases the risk of many chronic diseases, including cancer. It affects your mental health, leading to depression, fatigue, poor sleep, and increased risk of panic attacks. Panic is not anxiety. These words are often used interchangeably, but carry different meanings. Anxiety is a worried thought process originating from your emotional midbrain, also known as the chimp brain. Panic is one of your survival instincts and comes from the brainstem. This is the most primitive part of your brain and is sometimes called the reptilian brain, as it's also present in those scaly little critters too. Control of breathing, hunger, and thirst also originate in the brainstem. These functions just happen without you needing to think. This includes panic. The panic system has evolved over many millions of years and helps survival via the fight, flight, or freeze response. It's there to protect you, but the world is very different now to how it was when the panic system evolved. Panic changes the physiology of your whole body. Your central nervous system remains in sympathetic control and your blood is flooded with high levels of stress hormones. It's a physical process that causes very powerful feelings in your body, such as a racing heartbeat, faster breathing, a sensation of dizziness, shaking and sweating. The hyperfocused nervous system can't help tuning into those symptoms, making it hard to ignore them. This would all feel very normal if you got into some beef with a saber-toothed tiger, but it feels very abnormal if it happens when you're sat at home, at school, or at work. Panic attacks occur when the emotional chimp brain gets involved during a panic reaction. The anxious thoughts can further trigger the panic response, leading to a prolonged and excessive sympathetic reaction and stress hormone release. The physical sensations of panic get worse, meaning the anxious thoughts get worse and the vicious cycle of a panic attack is formed. To make matters worse, panic increases your breathing rate. This is so you can get enough oxygen to run away from a predator, which would be okay if your muscles were burning the oxygen and releasing carbon dioxide, as you ran away from or fought the disgruntled saber-toothed tiger. However, hyperventilating when you're not running or fighting means you blow out too much carbon dioxide without it being replaced by your muscles. This leads to hypocapnia, which is the medical term for low carbon dioxide in the blood. Hypocapnia makes your blood more alkaline. This is not harmful, but causes more unusual sensations in your body, such as numbness, tingling in the hands, feet and face, dizziness, muscle spasms, chest tightness, and this just adds to the vicious cycle of a panic attack. Panic attacks are not harmful, but they genuinely can feel like you're dying. If you've ever experienced one, you will know just how awful they are. As I said, I've been there too. So, the bit of the video you've been waiting for: how to flip your nervous system into parasympathetic control. When you take a breath in, your body temporarily enters sympathetic control. When you breathe out, you switch to parasympathetic control. You can test this yourself by checking your pulse as you breathe. You can find your radial pulse by following the base of your thumb onto your wrist and gently pressing between the tendon and bone. You can find your carotid pulse by pressing gently to the side of your windpipe. Take a slow breath in and you will feel your pulse speed up slightly as your nervous system enters sympathetic control. Take a slow breath out and you will feel your pulse slow down as you move to parasympathetic control. Very simply, if you spend more time exhaling, your nervous system moves to the calming parasympathetic state. Animals often instinctively do this to calm themselves, like Coco here, who often lets out a long exhale as she gets into bed. The best way to perform the exercise is to sit in a chair and allow your body to fully relax. Although it can be done standing or lying if needed, take a smooth breath in while counting to 3 in your head. Pause for a brief moment and then breathe out while counting slowly to 5, 6 or 7 to make the exhale longer than the inhale. During the exhale, let your whole body relax, letting gravity take control. It only takes a couple of minutes for this breathing technique to switch your nervous system into parasympathetic control, but continue for as long as you need. The effects of adrenaline only last around 15 minutes from a single release, so giving yourself a 15-minute target is a good starting point. This breathing exercise also has the benefits of making your chimp brain count numbers, so it can't say anything anxious in your head. The slow breathing also prevents hypocapnia by stopping hyperventilation, so it also reduces the additional uncomfortable sensations of low blood carbon dioxide. I always advise practicing this exercise when you're feeling calm, so it's easier to do if you're feeling stressed or having a panic reaction. It's also a good way to improve overall health even if you don't suffer the effects of stress, if the exercise is done regularly. When I used to have panic attacks, I found tensing my muscles in my arms as I inhaled and relaxing my muscles as I exhaled helpful to fight the panic-driven sensation of needing to breathe quickly. It can take a bit of time and practice to work properly, particularly if you're experiencing panic attacks, but don't let this put you off. Once you get confident and practice this breathing exercise regularly, you can take back control of your life. If you own a smartwatch, they often have a mindful breathing app to help you perform relaxation breaths using haptic feedback. They also focus on a shorter inhale and longer exhale, so you may find using your smartwatch helpful to keep you focused on your breaths. Even though I'm a medical doctor, I'm not your doctor, and I can't examine you through a video I recorded in the past. So please consult with your own healthcare provider if you're struggling with stress, panic, or any medical concern. I hope you found this video helpful. Stress and panic are horrible, but they are actually your body trying to help you. It's just not usually at the right time and is often an excessive response. If you're experiencing stress or panic, you have not done anything wrong, nor is any of it your fault. Show yourself some compassion. You deserve it. Always remember, we are all part of the universe together. Much love.